Hi, Dr. Kimmel here again. Today is Friday, April 17th, and I thought I would come back with another update from the Kimmel Institute. We hope everyone is staying sheltered and well protected. I know it's very frustrating for most of us as this is a profound change to what we're used to, but frankly, there really isn't a good alternative at this point. This is an example of where a short-term sacrifice will provide a long-term benefit. So I implore you, please be patient. I'd like to give you a few summation of facts from my perspective as things have evolved. As you know, I posted a video last week, and this is really an update. So first of all, if you've been following the news, reading or watching on television, however you get your information, you probably already know that the COVID-19 virus itself is both more contagious and more lethal than most other infections we've seen in recent times. This is not your typical flu. And despite a slow start in our country's response to this, we are now starting to see signs of a positive impact in the management of both the treatment of those who are affected as well as the spread of the disease itself. So we're not out of the woods by any means, but we're starting to see some progress. There's also very recently been some emerging evidence that in Florida, as well as other southern states, that while the impact will be profound and that many people will get sick and die, there is some early optimism that this will not end up affecting as many as originally feared. That's not to say we don't mourn those who we've lost and want to minimize everything we can in terms of illness and death. But again, the earlier models and projections seem to have overestimated what we may eventually see. So I think that should be taken as some good news. However, now is not the time to ease up on your antiviral behavior. And what I mean by that is, whenever possible, we need to limit our interaction with others and maintain the at-home sheltering. If we do go out, we need to wear face coverings, whether it's a homemade mask like this one that my wife made, or if it's a medical mask that you may have found or gotten somehow, or a scarf. You must keep your nose and mouth covered for two reasons. One, to protect yourself from spreading droplets or disease to others, and likewise preventing them from getting it to you. But the second reason is just as important. The mask itself over your face will remind you not to touch your face, because as we know, if the virus gets on your hands and you touch your mouth or your nose or your eyes, that's how you can very easily get infected. So wear face coverings when you go out. And in addition, hand washing is critically important to protect yourself and others. We also need to continue to be aware of our communities, helping our neighbors in need, supporting local businesses wherever possible. And this is important. Ask for help if you need it. Whether you're going a little nuts, a little depressed, or if you have physical needs, please reach out and ask for help. Because of my background and training as a cardiovascular surgeon, I've had a number of people recently asking my opinion about what we can expect over the coming weeks and months. Now, I don't have a crystal ball, but I do have an opinion based on the information that I've gotten. And I listen to the news, I listen to several different channels, I go online and get information. I get a dozen emails a day from various organizations, whether they be medical societies, surgical societies, the local, state, national public health announcements. All of these things I try to read and stay up to date on. So first, I'm optimistic that here in South Florida, we should be seeing the worst of this pandemic over in the next 4 to 6 weeks. Again, this is my opinion, not based on any statement that's been said by public officials. But I think, based on where we've been and where I see this moving towards, as well as by talking to other physician friends of mine from around the country, I think we should be past the worst of this, the peak, if you will, in 4 to 6 weeks. I would anticipate that there are some non-essential businesses that will be allowed to reopen either by early or mid-May, and that by June, I think most businesses should be able to reopen. Obviously, that's going to be determined by the governors of each state, but that's my opinion. As for the Kimmel Institute, while it's too soon to know for sure, it's my hope that we can resume seeing patients in the first full week of May. If Governor DeSantis's executive order is relaxed, then we'll also be able to schedule patients to have their procedures at that time. But again, I can't know for sure until that information comes out. The upgraded safety protocols that we instituted here in the office in mid-March will continue as long as necessary to protect both of our patients and our staff. This is critically important going forward, and I would anticipate this for not only many months, but even the next year or two. Our staff, which if you know us, you know that they're a wonderful group of people, have been working from home for nearly a month, and each one of them has told me that they are very eager to return to work. We have weekly group conference calls, staff meetings, and I've been in touch with individual members of the staff numerous times during the week as well. So for our existing patients, as well as for new patients who would like to come see us, I suggest that you check in on our Facebook page or our Instagram account on a regular basis. This is how we will begin to announce when our schedule will reopen. Again, I don't know the exact time, but as soon as we know, we're going to put the word out. And likewise, you're more than welcome to email us at any time through our website or at info@thekimmelinstitute.com. On behalf of my entire staff, we look forward to welcoming you back to experience the difference at the Kimmel Institute. And remember, experience is the difference. Be well.